Hello everybody, my name is Tran and today is Saturday, June 4th, 2022. I know it's been a while since I've provided you an update of where I am with my journey and experience with pancreatic cancer. I know in the last video I mentioned something about a third clinical trial that I was pursuing that would involve targeted therapy of the MTap Loss mutation of the tumor that I have, and that involved taking an oil pill on a daily basis. And now that was about 8 weeks ago, and at the time the CA19 numbers was about 32,000 units. 2 weeks into that treatment, those numbers increased to about 44,000 units. And speaking with the doctor, we came to an agreement that we would continue with the treatment in case that the tumor was just having an initial reaction to the drug. And 2 weeks ago, I went in and had a CT scan to see where I am with the tumor, and it unfortunately showed that it had grown, and the one in the liver has increased from 4 centimeters to 9 centimeters. The one in the pancreas has moved from 4.5 centimeters in circumference to about 6.5 centimeters in circumference. And then I also have some new spots. One in particular was the one in the vertebrae, the L2 vertebrae, which would explain a bad back incident I had 4 weeks ago playing golf, and I had a period where I could not even move because it was pinching one of my nerves. So it turns out that that was associated with the tumor eroding part of my vertebrae in my back. Today I am wearing a back brace to help, and it seems to help. And because the tumor has shown growth, we decided to go ahead and stop the clinical trial treatment. And my CA19 numbers at the moment is about 88,000 units. And I am now in a 30-day holding pattern because I have another clinical trial that I have lined up, and I am fortunate to qualify for this particular treatment. It involves a T-cell replacement of the tumor. So essentially the doctors would come in, remove part of the tumor, grow it in a lab, the T-cell, and then reinsert that back into the body. That particular treatment is very similar to the one that was shown in a news on NBC News for a patient in Portland that showed some success, and I wish her continued success as the tumor has diminished in growth. So for me, I again mentioned I'm on a 30-day holding pattern, and I hope that I will be able to participate in that treatment coming up in July. In the meantime, I'm doing some things to help maybe extend my days to participate in that program. I know I have nothing to lose, but my friend mentioned about trying liquid oxygen, and these are droplets that I put in my water that I drink on a daily basis, and so I'm trying that. I noticed that my intake of morphine, particularly the immediate release dosage, has increased. Before I was taking maybe 115 milligram pill in the morning and in the evening. Right now I find myself taking about 45 milligrams in the mornings and throughout the day, and then in the evening as well. So my pain level has increased. I mentioned about wearing a back brace to help with my back situation. I continue to struggle with eating, but I know that I have to eat, so I'm eating, I guess, smaller meals, but more frequently during the day. So I'm doing that. And other than that, nothing that I don't have to really share with you. I'd be interested in hearing from you. If you have any questions, let me know at the bottom, and I'll try to answer those as best as I can. And in the meantime, thank you again for joining me on this video as I give you some updates that hopefully will help you as you may be going through or know somebody who may be going through the same journey with pancreatic cancer. VTL, thank you again for watching, and I look forward to talking with you again soon. And take care and goodbye.